Hello, hello, hello. Welcome. I know we have people still kind of trickling in here, but my name is Cole. I'm the head of growth and one of the founders here at Move Health. And so today we're going to talk about turning 65, what you need to know about the transition to Medicare and things along those lines. And I'm really looking forward to covering off on that with you. So give me just a second. I'm going to share my screen and we're going to get started. I know that everybody has been waiting for Tuesday, June the 16th at 12 Central to talk about Medicare. But that being said, it is something that we need well versed in, and we should be well prepared for. And so today, the goal is that you have a firm understanding of how Medicare works, what it does do, what it doesn't do, and what you can do to prepare for an upcoming transition to Medicare. And so today you're going to get a high level overview of things. A couple important notes for you. This is being recorded, and so just always like to get that out there. Further, Josie from our team is there in the chat. We've got that. We've also got the Q&A box that is, there for you as well, where you can ask questions. We welcome those. So if you know where the chat box is at, which Josie dropped a note in, I'd love to know where you're tuning in from, where home is for you. I'm in Evansville, Indiana. That is where home is for me. So Indiana is home, and looking forward to, keeping things rolling today. And so here we go. Without further ado, we're going to go into turning 65 and what to know about Medicare. So before we start into that, it's important to note who we are here at Move Health and kind of how we work and what we do and how we do it. So a little bit about us at Move Health. We've got lots and lots of expertise in the health insurance and Medicare space. We are SOC 2 Type 2, certified and HIPAA certified, so that you know that your data is safe with us. We can also help with pre-65 health insurance in addition to Medicare. And we are a Wealthy Award winning platform, which means that we most of the time we are working with financial advisors and their clients. And so that's a little bit about us. You can see some of the places where we've been, published and all of those things. And so, kind of next up, we'll move on to our next slide here in just a moment. And you'll get to know a little bit about me. And so that's me there. I see, Josie, I know that you're in the Dallas-Fort Worth area. Jeff's a Hoosier in Jasper, Indiana. Good. So just north of us. Robert, good to hear from you in Camp Hill, PA, and Kevin, good to see you in Raleigh, North Carolina as well. And so glad you all are here. That's not the only four people, just the four people that were in the chat there. But a little bit about myself. More importantly than my role at Move Health is my role at home, which is dad and husband. And so that's my incredible wife, Megan, our two boys, Porter and Conrad, and we've got another one on the way this fall. Don't know if it's a boy or a girl yet, but we're excited about that. We live in an old house, a 1917 Tudor for anybody that is an architecture nerd like me. And we love renovating that. We've opened up almost every wall in that house. And I'm a musician, so I love playing music, and making music, whether it be at church or with friends. And I've done that professionally in the past, which is usually my fun fact for two truths and a lie. And so we'll kind of move on here and get into some topical things about Medicare. So we're going to go through the basics first. Some of this may be redundant, but also we think it's really important to start with information from the beginning, right? We want you to have an understanding of how original Medicare works and why we might need something to supplement or fill the gap or things along those lines. And so we're not going to get into carrier specifics today, and we're not going to talk about the different carriers and things along those lines. But what we will do is give you an idea of how everything works together. And then at the end of this, if you've got questions and want to learn more or need to connect with our team yet, feel free to connect through your financial advisor to us. We're happy to meet with you. So Medicare basics. So you all have maybe heard of some of these parts and pieces and plans of Medicare and all of those things. But as we think about traditional Medicare and Medicare Advantage, many times a 65-year-old or someone who's coming up on the transition to Medicare is posed with this question or this fork in the road. Do I go with traditional Medicare, Part A, Part B, Part D, and a Medigap plan? Do I go with a Medicare Advantage plan? What's a drug plan? Do I need it? What is this IRMA thing? Where's all this layer in, et cetera? And so today we're going to help to answer that question. And I'm not going to tell you which direction in the road and the fork in the road to go, but I will give you the pros and cons of each of them so that you have a clear understanding of how they work, what they do, and what they might not do. So first and foremost, we need to understand original Medicare. So, original Medicare is known as Medicare Parts A and B. So, Medicare A and B are also known, as I mentioned, original Medicare or traditional Medicare, and it's comprised of two parts, parts A and B, Alpha and Bravo. So, Part A, generally you pay nothing for it, right? You've paid for it. I say you pay nothing for it. You pay nothing for it when you actually are Medicare eligible, but you've paid for it through through paychecks, whether that be through you or a spouse, so long as you've worked 40 quarters or a spouse has worked 40 quarters, you get Part A for free. So generally $0. It does have a deductible of $1,736 for 2026. And that's a rolling deductible, on a 60-day benefit period. And so that resets theoretically every 60 days. But we're going to talk about why that might not be as important for us to key into. So if you're writing things down feverishly as I'm going through it, you don't necessarily need to worry about that 1736, but we include it in there because it's important to know that it does exist. It's 100% for approved home health, for hospice, for hospital. And so most of the time when you're in the hospital, the way that I describe Medicare Part A in a way that's easy to understand and remember is that Medicare Part A is the Jello that you are eating, the nurse that brought it to you, and the bed that you are laying in, right? And so that's the hospitalization portion. Part B is going to pick up mostly everything else, right? So doctors, the person who did the surgery, the radiologist, the person that's doing testing, physical therapy, all those things are going to fall under Part B medical. Now, Part A, as we discussed, Part Alpha, generally $0 so long as you worked your 40 quarters or a spouse worked their 40 quarters. And for those that are from Indiana and don't do math, do math as well as I do, that's 10 years typically of work. And so most folks are going to get Part A premium free. Part B is going to have a premium. And so you pay for Part B, and that premium will change slightly every year. It does usually go upward. But Part B is medical, and so that's going to have a $202.90 per month premium. And you can see that there's a little thing over here that says plus IRMA. Give us just a bit. We'll talk about IRMA as well. But 202.90 is the standard Part B premium. Now, also, it has a $283 deductible. That one you can write down. That one may be a little more important as we get down the line. And that's an annual deductible with Part B. So oftentimes people go, wait, there's a 60-day, per benefit deductible period for Part A, and there's an annual smaller deductible for Part B. It's incredibly confusing, which is why we have dedicated our time, effort, and energy to making this simple and clear for the clients that we get to work with. And so it's got a $283 deductible. Part B does. After that deductible is met, after you've satisfied that, Medicare is generally going to pay 80% of your costs. So that also means that you pay 20% of your costs. And someone might say, well, it's got no maximum out of pocket, as it's a positive thing. When I hear that, I go, it's got no maximum out of pocket. It means the sky is the limit. So I'll give you a real life example, right? As I go over here and give my warning label on here that Part A and B only cover 80% of the costs, the important thing to note is, I'll give you a real example. I was lucky enough last September to have a knee reconstruction surgery. I had an ACL, an MCL, and a bilateral meniscus. So if there's any orthopedic doctors out there, you guys go, man, he really screwed up his knee. And I did, and so I had that repaired, and it was an outpatient surgery. I was in at 5 in the morning and out by 2 in the afternoon, and was home and all those things. But that surgery was highly specialized with a highly specialized doctor, highly specialized equipment, all of those things. Or at least I hope that's what they told me. Maybe they just stayed at a Holiday Inn Express. But no, they were highly specialized equipment, etc. And all of that to be said, that insurance, that plan was billed at $100,000, right? So that surgery would have cost me $100,000 if I had no health insurance coverage. That's what was billed to the insurance company. Now, if I had just Medicare Parts A and B, I would have paid $20,000 for that surgery because Medicare Part A would have picked up the hospital portion, Part B would have picked up the surgeon and the equipment and all that stuff in the room. But I would have been responsible for $20,000 of that. Now, We don't want that to be your case. And, even if it were something where or more, say it were a $200,000 surgery, I would have had $40,000, right? Maybe there's a hospital stay associated with it, right? And then it becomes more and more expensive. So this is why it's important to have something that supplements Part A and B, which we're going to talk about here in a moment. So we talked about Part A, Part B. One of the things that I touched on was IRMA, right? And so IRMA is the income related monthly adjustment amount. And why do I talk about this? Well, because it does apply to your Medicare Part B and Part D. We'll talk about Part D in a little while, but it does apply to your Medicare Part B and Part D premiums. Now, IRMA, what I say often is that IRMA it's not your auntie, it's not a hurricane. IRMA is the income related monthly adjusted amount, and it's based upon your income from 2 years ago. And so the federal government, the Social Security Administration, is going to say, all right, based upon your income from 2 years ago, you may have to pay more for your Medicare Part B and Part D premiums. Well, that's no fair. Why? If I'm not making that anymore. Well, you can appeal it if your income has gone down drastically as a result of a work stoppage or things along those lines. And so there is a path to do that. But say that you were a high income earner and you will continue to be a high income earner. It's based upon your tax filing status and your income from 2 years prior. So you can kind of go through this table, and if I look at a married filing jointly couple that maybe made $500,000 in 2024, they would pay $649.20 for their Medicare Part B premium. So that's obviously in addition to, not in addition to, but inclusive of the 202.90, which is the standard Part B premium. And then in addition to that, I'm going to pay an additional $83.30 tacked onto my Part D prescription drug plan. And so important to note that IRMA can be there. We will cover off on that with you. It can be appealed in particular situations where, again, you have a work stoppage or there's a reason, maybe your income has gone down, we've retired, things along those lines. All of those things can be a reason to appeal it, and where you can go maybe down from 649.20, sometimes down to the standard Part B premium. But what I always say is any reduction in IRMA is a good reduction in IRMA. And it's not that it's always going to stick around. So as your income goes down and you maybe don't appeal it, but as your income goes down, it will, it will go down with it. And so, but it's looking at income from 2 years prior. That's the important note. It's not looking at your current income. It's looking at the one from 2 years prior. So that's IRMA. Feel free to ask any questions in the Q&A that might come up, resounding or around that. And so, the next component is we talked about how Part A and B only cover 80% of your medical costs. Now, you also have to choose a coverage option to supplement that. And so there's two methods in which you can supplement Medicare. So original Medicare A and B, they're going to cover 80% of your costs, 20% you're going to be on the hook for. So one option that you can do is a Medicare supplement or a Medigap plan. So important to note, Medigap and Medicare supplement are synonymous. Those are referencing the same thing. So a Medigap plan, what are some of the features or characteristics of a Medigap plan? Well, it's got a monthly premium, but usually has no copays or very low copays. Now, when you have a supplement, you have the freedom to choose doctors and you don't need referrals to see specialists. Why? Well, because when you have a Medicare supplement or a Medigap plan, its job is to act as secondary to Medicare. And so when you go to the doctor's office, you're going to give them your red, white, and blue card, and you are going to give them your Medicare supplement card. The doctor's office is going to bill original Medicare, red, white, and blue first, and then whatever else is left over is going to be billed to your Medicare supplement. And so the Medigap plan is really working hard on that 20%. And there's a lot of different options of Medigap plans, and they're confusing enough. They are also lettered, and we'll talk through those. But the important thing with the Medicare supplement to note is that it does have a monthly premium. You pay for it in addition to your Part B and Part D premium. But it's going to give you the most flexibility. You can go anywhere where Medicare is accepted. And so if you say, I want to go to Mayo Clinic in Jacksonville, Florida, or in Minnesota, or I want to go to Cancer Centers of America in Arizona, as long as Medicare is accepted there, you can go, and your Medigap supplement, your Medicare supplement, is guaranteed to pick up what original Medicare doesn't, according to the plan details. So it does require also a separate prescription drug or Part D coverage option policy with it. Um, Medicare Advantage, on the other hand, now typically a Medicare Advantage plan, some of the characteristics is that it's going to have low or sometimes in most cases no monthly premium, right? So it's going to have no monthly premium, but you're going to pay more when you actually go to use it, right? So you're going to have co-pays that are paid at the time of service. The other component when you have Medicare Advantage, and we'll do a deeper dive on this in a moment, is that you may be restricted to a specific network and have only emergency services that are available outside the service area. And so this includes, because you are inside of a network, referrals to a specialist may be required if you're on a Medicare Advantage plan. And some plans may include, some extra benefits like over-the-counter benefits. They may include drug coverage in most cases. They may include some dental coverage, some vision coverage. They might say, hey, we're going to give you a card to get silver sneakers at your local YMCA or things along those lines. It's kind of some perks that are built in. And so that's Medicare Advantage. A little less flexibility, lower monthly costs, and referrals and things like that may be required. So you can think of Medicare Advantage as kind of acting like health insurance before age 65, where you have a deductible and you got co-pays and things along those lines, and you need to stay within a network, things along those lines. And so that's Medicare Advantage. Happy to answer any questions as you all have those, and we'll do a deeper dive on each of these as well. So as we move forward here, Medicare supplements, these were originally started in the 60s and 70s, but they weren't regulated until 1992. Now, a traditional Medicare supplement, as we just talked about, Medicare A and B are the primary payer, right? So if I use some insurance terminology here, the primary payer is the person who is paying first, right? So red, white, and blue Medicare, A and B, are the primary payer. They're going to pick up the first 80%, and then your Medigap plan is going to be secondary. And so, again, when you go to the doctor, you're going to use your Medicare card and your Medigap card. And if the doctor accepts Medicare, they're going to accept your Medicare supplement. So they're not going to say, you've got an Acme Looney Tunes insurance Medicare supplement. We don't take that. Well, you guarantee to bill it if you bill Medicare. So Medicare supplements. The two most common Medicare supplements in the United States currently, as far as covered individuals, are Medicare Supplement Plan F and Plan G. Now, it's important to note that a Plan F, if you're turning 65 this year or soon, or you're not 65 yet, you are not eligible for a Plan F. And so that's why we've got Plan G circled there. Plan G is kind of the most comprehensive outside of a Plan F. So, the only things that you have to cover are in relation to, the part, I need to change that, but the Part B deductible, is what a Plan G is responsible for, which is that $283. And so I'm going to get to a screen here that's going to help us to walk through that here shortly, which is going to load up. And so Medicare supplement options. So this is Medigap, right? An important note here over to the right is that there are a lot of Medigap plans available that can provide different levels of benefit depending on the needs of the individual. So you can see there at the top of that chart, we've got Medicare Plan A all the way through Medicare Supplement Plan N. And, there's B and C and D and F. I don't know why we skip E, but we do. G, and then we skip some more, and then we go K, L, M, N, right? So all of that to be said, the places where we look most often is here in Medicare Supplement Plan G, right? Why? Look at all these green check marks. Well, we're missing one here. What are we missing? Well, it's the Part B deductible. So, as an example, if I were covered by a Medicare Supplement Plan G, with original Medicare, so I've got A and B and a Medicare Supplement Plan G, I won't ask it and make everybody answer. If I had that same $100,000 knee surgery, what would my cost be? Well, my cost would be just the 283 Part B deductible, and then I'd be done, right? So another good example of this is I had a family member who is turning 65 this year, and they're turning 65 a little later this year, and they said, hey, I need to have a hip replacement. And I said, all's well and good there. That's fine. They said, I think I'm going to do it in May. And I said, don't do it in May. And they said, why? I said, well, is it an emergency? First off, and they said no. And I said, okay, great. Don't do it in May. Wait until August when you're on Medicare. And they asked me why. And I said, well, the difference being is you are on a health insurance plan pre-65 that has a $5,000 deductible. If you have that hip surgery, you can plan to spend $5,000 on that surgery, right? Whereas with the if you're on Medicare and you have a Plan G supplement, parts A and B, you're going to spend just $283 on that surgery and you're going to be done for the year. So all your physical therapy, all those things are covered at 100% after you've satisfied that Part B deductible of 283. So that's why that is an important thing. Now, note, I can tell you exactly what the exposure is without ever talking about an insurance carrier. How can I do that? Well, all Medicare supplements are what's called substantially equivalent based on the plan letter chosen. So the easy way to think about this is a Plan G is a Plan G is a Plan G. A Plan N is a Plan N is a Plan N. So it doesn't matter the insurance carrier that you choose, they are all contractually and federally obligated to do the same things. So a Medicare supplement, Plan G, whether it is with Blue Cross Blue Shield, or it is with Cigna, or it is with Acme Looney Tunes Insurance Company, like I talked about, they're all going to cover the same things. Now, what do we look at when we look at choosing a Medicare supplement? Well, we look at historic rate increases, making certain that they're not going to jump up really high. We look at, sometimes an insurance carrier will have a really, really competitive turning 65 rate. So when you go to Medicare.gov and you pull up your options for a Medicare supplement Plan G, and you go, oh, wow, that one looks really inexpensive. I'm going to go with that. And then the next year you see a 20% increase. So there's kind of this bait and switch sometimes where you're looking at a large rate increase because they gave a great introductory rate. And so when you're looking at Medicare supplements, it's important to note that those will go up in price from where you buy them at initially, right? Beyond just that, they also, they're going to be substantially equivalent. So they're going to cover the same things. And so it's important to note we look at historic rate increases, reputability of the carrier. Are they new to the Medicare supplement space? Are they a long-standing name? As we think about Medicare supplements, you think of big names like Mutual of Omaha. They have a lot of foothold. United Healthcare with AARP has a lot of foothold in this space. Now, it's not always that we are going to recommend those options. We're going to look at obviously the initial cost and premium and things along those lines, but we're also going to look at reputability of the carrier, historic rate increases, things along those lines as well. If you've got a no-name insurance carrier that's got a really low introductory rate, they probably have a small enrollment pool, which means that rate increases are going to be felt more sharply by members. Whereas if you've got more members, you can kind of spread out those rate increases over a larger pool, and they become a little more, tepid, and they don't feel quite as abrupt. And so important to note, there are other options. I have never seen someone, at least I don't know someone that is enrolled into a Medicare supplement plan A, B, C, D, K, L, or M. Primarily, we see Plan G and Plan N. There is a high deductible variant of Plan G as well. So all of that to be said, Plan G, Plan N are kind of the most popular, Plan G being the one that's going to be most comprehensive, reducing your out-of-pocket exposure to the highest degree. Next up is we look at comparing Medigap plans, right? These are just examples of Medigap plans that may be available to someone. This is a sample here. You can look at, there's different premiums. Well, why is there a different premium for each of these? Well, again, insurance is a transfer of risk. Now, these two that are here are identical. They're going to cover the exact same thing. Globe Life and AARP, which is by United Healthcare, they're going to cover the exact same things. Well, why are those different premiums? Well, sometimes you're paying for a brand name, right? Sometimes you are paying for the United Healthcare name. Other times, again, they might look at a lower introductory rate and see higher rate increases year over year. And just because they're lower cost initially does not mean they're going to have higher rate increases, et cetera, but you're looking at historic for that. And so then we're going to pull in, what's your annual financial risk? Well, that's your premium times 12 plus the out-of-pocket maximum. And then you can see here the Plan G, right? And what those, the differences in rating types and things along those lines. There's also a high deductible Plan G, which looks great until you say, it's got a significant amount, $2,600 more out of pocket exposure, and it only saves me $60 a month or $700 a year. Well, that doesn't really shake out. So that's a lot of times why we're recommending a Medicare supplement Plan G. It offers the most flexibility, the lowest out-of-pocket exposure, and again, is going to be kind of your Cadillac option when it comes to Medigap plans. Now, Medicare Part C. So we talked about Medicare Part A, that's alpha, that's hospital. We talked about Medicare Part B, which is the medical side of it, doctors and labs and physical therapy and things along those lines. And someone might say, well, Medicare Part C, that's a part of original Medicare, right? We go, no, 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 it's not. So it's not a part of original Medicare. Original Medicare is Part A and B. Medicare Part C is Medicare Advantage. It was created in 2006. And what you need to know about it, right? We talked about that you still have to, pay your Part B premium, but typically a Medicare Advantage plan is not going to have a monthly premium associated with it, whereas a Medicare supplement or a Medigap plan will. That said, deductibles and copays are set by the insurance carrier that you choose the Medicare Advantage plan with. It cannot be used in conjunction with a Medicare supplement, so you can't say I'm going to double dip and get a Medicare Advantage plan and a supplement. And they may offer some of those additional benefits. Now, these operate on a network. Why do they operate on a network? Well, let's go down here and zoom in on this important note. A Medicare Advantage plan is actually coverage through a private health insurance company. So if you remember some of that phrasing that I used around primary payer and secondary payer, when you become a Medicare Advantage member, the insurance company, whether it's Looney Tunes Insurance Company or United Healthcare or whomever, they become the primary payer. So, what do they like to do? Well, they like to say, hey, we want to make certain that we can keep costs low and that we keep loss ratios, to a minimum. And so they're still going to bill parts A and B, but they're going to administrate your Medicare benefits on your behalf. And so then they're going to say, how do we control cost? Well, we do so by saying, hey, you got to use an in-network in most cases, provider. And you might need a referral, and you're going to have a deductible, and you'll have copays, and you'll have a out-of-pocket maximum that might be upwards of $8,000, but not always more than that. That can depend on the area. But again, it's going to act a little more like insurance before the age of 65. So less flexibility, but also lower cash flow, outflow from the plan itself, at least if you don't use it. So it's kind of one of those things where you say Medicare Advantage plans are great if you are not going to utilize them. You're a low user or you want predictable costs. Now, we almost never, for someone turning 65 for a variety of reasons, recommend a Medicare Advantage plan from the beginning. We're almost always going to say, hey, let's keep the highest amount of flexibility possible and stick with a Medicare supplement, Medigap plan. Why? Because you can always go, and we'll talk a bit more about this in a moment, you can always go to a Medicare Advantage plan whenever. You can't always go to a Medicare supplement. And so I always like to make certain that folks understand that a Medicare supplement from the beginning is going to provide the most flexibility. A Medicare Advantage plan is a unique option. There's a lot of folks that are enrolled into Medicare Advantage plans, but a lot of times when you enroll into a Medicare Advantage plan, you limit or remove the optionality of going back to or joining a Medicare supplement at all. And so we'll talk about that a little bit longer here in just a moment. But Medicare Advantage, you're going to have HMO networks, PPO networks, things along those lines. You're going to have a deductible, a maximum out of pocket, copays, things along those lines that are important to note. And why do you have those? If you remember, you're still going to pay your Part B premium. They're still going to bill Medicare Parts A and B, but they're actually contracted with Medicare, and they're going to administrate your Medicare on your behalf. So Medicare Advantage takes A, B, and most of the time D, kind of mushes it all together and says, here's this. Now, we made it easier for you because it's less administration, and less costly, but we get to control where you get to go and doctors you get to see, and there might be step therapy required where they say, hey, we know that you need that hip replacement, but we want you to go to physical therapy and do 5 rounds of cortisone shots before we approve the surgery, things along those lines. And so that's Medicare Advantage. Happy to answer any questions that you have as we kind of continue along. Now, as we look at Medicare Advantage, as I mentioned, it bundles everything together. Now, this is an example of Florida where Medicare Advantage plans are, have lower financial risk associated with them, lower out-of-pocket maximums, and there are networks, right? So here's the Blue Medicare Classic and the Devoted Core and Cigna Preferred. These first 3 are HMOs. This last one is a PPO, but not all PPOs are created equal. And so, what are your drug costs associated with it? What are your out-of-pocket exposure numbers that are associated with it? Does it have a premium? Does it not? Those are all important things to understand. Do I really need a Medicare Advantage plan, or does a Medicare supplement make more sense for me? So it bundles everything together, as I kind of mentioned there. As we kind of move forward, it also is where you're going to have to layer in, do my doctors take it, right? So you might say, I go to UCSF in St. Francis. Well, Cigna, it's not in network there. What about Dr. Smith? Well, Dr. Smith's in network with all of them, but I can't go to the hospital I want to go to. That one's out, right? And so that's where that comes into play. Whereas with a Medigap and Original Medicare on the other side of the fork of the road, if you will, is totally unrelated, right? So they're going to say, does UCSF you know, take Original Medicare? They do? Great. Okay. And so those are things that you want to layer in and think about when you're making that decision. Same thing for medications. They're going to have their own formularies that you need to be thoughtful around with Medicare Advantage. Are your drugs covered on that Medicare Advantage plan? Key learning number 2. So we went through Original Medicare, Medicare supplements, Medigap plans, and Medicare Advantage plans. Now we're going to talk about drug plans. This is Part D. Part D is in drug. The only side of it that makes phonetic sense. Part D is in drug, and so here's where we're at in the fork in the road. So we talked through kind of the options and thoughts. Medicare Advantage is most of the time going to include Part D, but traditional Medicare does not. You have to buy a standalone Part D plan. And so Part D drug coverage, what you need to know. Part D drug plans are provided by private insurance carriers, and they're going to have, it's going to be a lower monthly premium, right? So this is not going to be hundreds of dollars. A Part D plan, I think the average Part D prescription drug plan is $30 a month, and most are lower than that. There are some that are higher dollar that you might pay into if you have specific drugs, things along those lines. But they're provided by private insurance carriers. Medicare Advantage many times includes Part D coverage. And Part D plan premiums are going to vary from plan to plan. And why would that be? Well, each plan is going to have its own, what's called, another insurance term, a drug formulary, right? So a drug formulary, what does that mean? Well, a drug formulary is, the big long list of medications, and usually it's a 150 plus page document of drug names and their tiers and all of those things. We know how to read them. You don't need to worry about that. If you'd like to do some light reading, you certainly can. But Medicare is going to, the Part D plans are going to have their own formulary. And each drug plan is going to have its own version of that. And so there may be a specific medication that you take that is covered by one private insurance carrier's Part D plan, but not another. And so it's important to always double check, are my drugs covered? So we'll do that alongside of you. Important to note, you have to have some form of Part D drug coverage to avoid late enrollment penalties. If you don't, you begin accruing a late enrollment penalty for Part D that never goes away. Even when you go to pick up Medicare Part D in the future, it becomes something where you need to pay a premium that is inflated because you've got a penalty that's associated with it. And so if you're continuing to work past 65, we'll talk about that here in a little while. You don't always have to pick up Part A, B, and D, but we'll talk about the reasons why you would or would not do that. But you got to have Part D coverage in some capacity. So what's changed recently? For 2026, there's a $2,100 out-of-pocket maximum cap for drugs in 2026. So this didn't always used to be the case, right? So I think about another personal experience. A neighbor of mine in my neighborhood, they take several expensive medications, high dollar medications, and they went through the donut hole and all these catastrophic phases and all these things with their drug plan prior to 2025 when this cap came out, and they were spending upwards of $8,000 a year on their medications. Now with this, there's a $2,100 cap for them for out-of-pocket costs. And so really, really important that, folks note that. What I always say is if you take a medication that sounds like it could be a European sports car, you should plan to hit the $2,100 out-of-pocket maximum. If you take drugs that sound like they could be a Ford Taurus, I take atorvastatin and lisinopril and, things along those lines. They sound like they could be a Honda or a Kia or something like that. You're probably not going to hit that. But if you take a Lamborghini Eloquist or a Mercedes-Benz Jardiance, right? That's be thoughtful around that. You may be paying a little more for your drugs, but there's that $2,100 cap, and so it does not apply to non-covered drugs. And so as I talked about that big insurance term formulary, the drug to have the cap apply to it must be on the formulary. And so it's important that you do your research and understand, does the plan cover my medications? If so, at what tier? And what should I expect to pay on an annualized basis? So we'll help you to do that. Moving forward here, as you compare Part D plans, we can look and we can see, okay, here's the medication that we take, here's the pharmacy that we go to. It's important to note that pharmacies even have a network. And so you got to choose a plan that your pharmacy's in network so you get the best rate, because there's preferred in network, and out of network. And you'll pay less when you go to a preferred in network pharmacy. And so you always want to look at that. So in this example, there's, this person takes Lipitor 10 milligram monthly, and they have a $20 annual drug cost. This plan has a $0 premium. How could that be? Well, WellCare is the largest Part D prescription drug plan provider in the country. They have they had, I should say, this should be a 2025 example, but they had a premium that was $0, for one of the plans, the value script in some areas, and it covered generic medications at a very low cost. So this person might fill this medication 3 times a year. They might fill it with a 90-day supply, and it's probably a $5, copay when they get that. So that's how that process works there. There was something that came up in the chat there, so I might pull that up here in just a moment. And computer's moving a little bit slow, so I'm going to zip along here to our next slide. So give me just a moment as we kind of get going there. There we go. Okay, awesome. So Medicare Part D drug coverage. Do I need to enroll in drug coverage? Yes, you do. What if I don't take any medications? Well, you need to pick the least expensive plan, or you risk having a late enrollment penalty, as I talked about. Other creditable sources of drug coverage include TRICARE, VA coverage, or your spouse's employer plan, given that they are still working. So the other component to think about is ensure, if you go the Medicare Advantage plan route, that you have embedded drug coverage if you're on an Advantage plan. So that's important to know. So key learning number 3, important timelines, right? This is going to slide over here in just a moment. Important timelines to consider as we get through the Medicare enrollment periods, right? So the initial enrollment period, your IEP, it's actually a 7-month window. It's 3 months before your 65th birthday, the birthday month, and 3 months after. So if I turned 65 in June, if I say I turned 65 on Tuesday, June the 16th, right? And that's today for those that haven't looked at a calendar. But it's today. So my Medicare initial enrollment period would have begun 3 months before June, right? So if I go backwards, I go May, April, March. My IEP would have started in March. It would be also in June, and then it would be July, August, and September. So it's a 7-month window. What can you do in this period? Well, this is when you can pick up your Medicare enrollment for A and B. We'll talk about if you're working past 65 and things along those lines as well, but you can enroll into Original Medicare with a Medicare supplement or a Medicare Advantage plan, but you got to get Medicare Parts A and B first. If you miss this initial enrollment period, it is possible that you have late enrollment penalties, not only for Part D, but also for Part B. And the Part B late enrollment period is a bigger one. It's 10% of the annual premium, and it never goes away either. So, let's say that I had a year-long window where I didn't have Medicare where I should have, and the standard Part B premium this year is $202.90. Well, guess what? I'm going to spend $20 a month in addition to that $202.90 forever in the event that I had a late enrollment penalty for Part B. So we help you to avoid that. Don't be stressed out about it. We'll talk through that with you, but do your best to miss late enrollment penalties by enrolling during this period of time. Now, one of the things that I wanted to make certain was very, very important to note. You see that important note there at the bottom. Enrollment into a traditional Medicare supplement is typically guaranteed issue for a period of up to 6 months from your Part B start date. So I talked about how you can always go from Medicare supplement to Medicare Advantage, but you can't always go back. Well, what happens if you're outside of this 6-month window from your Part B effective date and you want to get a Medicare supplement? Well, now you have to go through medical underwriting. That's another fancy insurance term. And medical underwriting means they're going to ask you your height, your weight, the medications you take, and all those things. And those insurance carriers that have to accept you during your initial enrollment period now don't have to. If you're outside of that 6 months from your Part B effective date, they can then say, hey, we want to underwrite this, and we don't like that medication that you take, or we don't like that diagnosis you had 2 years ago, or what have you. And they can say, we're not going to accept you, or we might rate you up. So, important to note that a traditional Medicare supplement is only guaranteed issue for a period of time, which is 6 months from the Part B start date. There are specific states that have different rules around this, but as a good rule of thumb, Medicare supplements, you can only get guaranteed issue for a short period of time. And so that's important to note. So that's your initial enrollment period. It's a 7-month window, 3 months before your 65th birthday, the month of your birthday, and 3 months after. As we move on to our next screen here, we're going to talk through the annual enrollment period. So this is the fall when all these mailers start flying out and you're getting talked at by Fraser Crane, or Kelsey Grammer, I guess is a government name, but or an NFL quarterback or someone that's saying you need to enroll into a plan. Well, one, they're talking about Medicare Advantage plans there. That's important to note. But that's also talking about the annual enrollment period. And so this is a time of year where you can make changes to your prescription drug coverage. You can change from original Medicare and a supplement to a Medicare Advantage plan. You can also make the switch, so long as you can pass that underwriting we just talked about for a Medicare supplement. You can switch Medicare Advantage plans if you're already enrolled into one. You can switch from an Advantage plan that doesn't offer drug coverage to one that does. And you can, again, change your drug plan. One thing to note, if you go the traditional Medicare A and B with a Medicare supplement and a drug plan, what we say often is you want to marry your Medicare supplement and date your drug plan. So when you join a Medicare supplement or a Medigap plan, typically the October 15th through December 7th window is not going to apply to your Medicare supplement. What it will apply to is your Part D coverage, because those formularies, if you remember that fancy insurance term again, those formularies can change on an annual basis. So it's important to note that that you make certain that you're covering your bases there on Medicare, and when you need to change your drug plan, change things. And so if nothing else, review your drug coverage every year. That's an important one to note. If you're on a Medicare Advantage plan, this is the time of year where you can make changes to that as well. Now, last but not least, as far as Medicare enrollment periods, is the Medicare Advantage open enrollment period. So you can make changes to your Medicare Advantage plan in October and November, and a little bit of December. You can also make changes to a Medicare Advantage plan if you're enrolled into one January 1st through March 31st, so the first quarter of the year. So this only applies to folks that are on original or on a Medicare Advantage plan. And so you can make a switch. You can drop your Medicare Advantage plan. Not sure why you would want to do that, but you could make a return to original Medicare potentially. And then enroll in Part A and B. If you missed your initial enrollment period, you can do that during that period of time as well. What you can't do is you can't switch from original Medicare Part D drug plan and a supplement to an Advantage plan. You can't join a drug plan if you're already on original Medicare with a supplement, and you can't switch your drug plan if you're on original Medicare. So that's what you can't do during that time of year. We'll make certain that you all get this replay and deck here as well. Here's a couple bonus learnings that I always like to make certain that we cover off on. So working past 65, some special considerations. I told you I would cover off on this, and we're kind of landing the plane here, if you will, proverbially. If you continue working beyond 65, so this may apply to you, you must work at a place that has more than 20 full-time benefits eligible employees, that provides health insurance and creditable drug coverage. You actually don't need to enroll into any part of Medicare, but you need to defer Part B. That being said, many folks that are in this situation will pick up Medicare Part A at that point at 65, because it will coordinate with your employer insurance and reduce rates, or reduce your costs potentially if you're hospitalized, things like that. But there's no reason, if you have employer coverage at an employer with more than 20 full-time benefits eligible employees, that you need to start paying for Part B. Now, one thing to consider is sometimes your employer plan is actually more expensive than just taking Medicare in full. So Part A, B, and a Medicare supplement and drug plan. And so sometimes that's a worthy consideration, even if you plan to continue working past 65. But if you're working past 65, you work at a large employer with more than 20 employees, you don't need to do anything with Medicare right away. You might need to defer it though. Next up is if you're receiving Social Security benefits for 3 or more months prior to your 65th birthday, you're automatically going to get Medicare Parts A and B. If you don't want Part B, so if you're still working, but you are drawing Social Security, you don't want Part B, they're going to send you your card automatically. And what you need to do is there's instructions on it. You sign the back of it, you send it back and say, I don't need Part B yet. And because Part B, if you remember, is the thing that triggers that initial enrollment period for a Medicare supplement to be guaranteed issue. So we don't want to burn through that window if we can help it. If you're receiving Social Security benefits for 3 months prior to your 65th birthday, you're automatically going to get Parts A and B. Next up, if you're working past 65, be sure to stop HSA contributions 6 months before you intend to transition to Medicare. So say I didn't do anything with Medicare, I'm working past 65 at a large employer, and I want to continue contributing to my HSA. Stop contributing 6 months before you intend to transition to Medicare. Why does Cole say that? Why do I need to stop 6 months before? Well, Medicare Part A, Alpha, hospital part, can actually backdate, in most cases does, backdates up to 6 months. And so if I said, hey, I'm starting Medicare on July the 1st, I would have wanted to stop my HSA contributions at the end of January. And so that's an important note. So if you're doing that, have questions around HSAs, we've got some great resources and a great team. Last thing here on working past 65, COBRA coverage is not considered creditable coverage according to Medicare. COBRA and being Medicare eligible are like oil and water. Do not take COBRA if you are 65 or older. Do not. Why do I say that? Well, because when you take COBRA within the bylaws of COBRA and the way that it's created, COBRA only needs to cover the portion, is only required by law to cover the portion that original Medicare wouldn't. So if you don't have original Medicare and you say, I'm just going to take COBRA, I'm not going to pick up Part B and get a supplement and all that stuff, COBRA only needs to cover 20%. So it's kind of the reverse of what original Medicare will do. COBRA will cover 20%. And so that $100,000 knee surgery, that I had, if I were on COBRA and Medicare eligible but had not taken Medicare insurance, COBRA would have picked up $20,000. I would have paid 80, right? And so COBRA and Medicare, they don't mix. If you know someone that has those, tell a friend, to avoid that. I always like to say what's not pictured between the differences in these two options, right? Annual financial risk is nearly identical on these between traditional Medicare and Medicare Advantage. It looks like there's a bit of IRMA that's applied here, things along those lines. What's the difference? Well, the difference is annual out-of-pocket risk, right? You're going to pay more for a Medicare supplement with traditional Medicare on the front end. You'll pay for it more month to month, but when you actually go to use it, you're going to pay significantly less. Now, the other thing that is not contemplated here is a network, right? Traditional Medicare there on the left is going to provide much broader network access to specialists, no referrals needed. Medicare Advantage, you might run into some red tape there, so it's important to note that as well. What to check when you're enrolling into Medicare? Provider networks if you're exploring Medicare Advantage, the drug formularies I talked about, drug costs, rate increases historically if you're exploring Medicare supplements, carrier stability, verify if IRMA is going to be in the picture for you, and out-of-pocket exposure. We always want to know and key into what's my worst year ever on this plan? What do I need to be thoughtful about? What happens if I have a big diagnosis or a big surgery or you hurt your knee like Cole does? Things along those lines. What's my worst year ever? What's my out-of-pocket exposure? Those are important notes to think about and consider. What's your next step? Well, if you have questions and want to meet with us, if you believe that Cole did a good job, he's just not a guy in an orange shirt with good hair. He's also knows his stuff. You want to meet with our team, contact your advisor to initiate a health planning analysis for your transition to Medicare. We like to think about this about 6 months before turning 65 or making that transition to Medicare. And so within that health plan analysis, we're going to do an overview of coverage. This could be pre-65 coverage as well. And so many times you've got a spouse who turns 65 and one that may be younger. We can help coordinate and work through that with you. Other insights that we're going to look into are carrier stability, drug costs, things like that. So like I mentioned, we do the same work in the health insurance space on pre-65. So if you're retiring before the age of 65 and need help, we can help with that. Reach out to your advisor. They'll kick off, a health planning analysis process for you. You'll meet with our team. You'll fill out a household profile. You'll connect with us, and we'll be able to serve you from end to end, being able to say, hey, here's the education component all the way through to here might be the plan that we would actually select and suggest and help you enroll into. If there are any questions, I'm happy to answer those. You can also reach out to us, info@movehealth.io. Again, that's info@movehealth.io, or reach out to your advisor and we'd be happy to connect with you, answer any further questions that you all have. And really, really great to spend some time with you today on a Tuesday in June talking about Medicare. I enjoyed the time together. Grateful to be with you all today and thankful for it. So if there are no other questions, we're going to wrap up our time now. Thanks for joining. We will talk to you all soon. This has been Turning 65, What You Need to Know About Medicare with Move Health.